Hello, my name is Brittany Porter. I am a baccalaureate student nurse at the Indiana State University. This is my N444 Health Education Program for Community Health. It is on imbalanced nutrition in the elderly population. Here you can pause the slide and click on the link below. There is a pre-test and the same test you can take for a post-test that will help test your knowledge prior to this presentation. You can then take the same test upon completion. The second link is a handout that will help to summarize this presentation along with the tools to screen for malnutrition in the elderly. The learning objectives are that both the population at risk and the learner will be able to compare their current nutritional status to the new ideas that are learned. They will be able to formulate a plan to incorporate the new resources into their grocery shopping habits. They will be able to incorporate exercising into their daily routine to further enhance their nutritional intake, and to differentiate between healthy food versus fast, quick, and easy foods. Here are some screening tools that can help assess the population at risk. One is a mini nutritional assessment, and then the other is a malnutrition screening tool. You would check the boxes on the numbers that correlate to the answers of the resident or patient, and depending on your score would give you an answer if they're at risk or not. The elderly population is at risk for imbalanced nutrition and/or malnutrition due to multiple factors. Many of them are on a limited set income. They have limited resources available. They have a lack of transportation. They may live alone, and their food choices might be based on accessibility. The nutritional changes with advancing years are below. They have reduced energy expenditure, which is a decrease in your basal metabolic rate, and decrease in physical activity. The physiological changes are hormonal changes, increased cytokines, and decreased taste and smell, along with gastrointestinal changes. This leads to anorexia of aging. There's also pathological changes, which are medical, social, or psychological induced. Changes in taste. So as we age and get older, our tastes and smells decline, which can lead to a decrease in food enjoyability and excitability. This can also factor into what foods are chosen to eat. A decreased sense of taste can lead to a less varied diet, which can in turn lead to a development of micronutrient deficiencies. The loss of taste is not fully understood. However, multiple medications and comorbidities can lead to this alteration. Increasing the flavor of foods can help to improve the nutritional intake. Early signs of malnutrition are eating poorly, chewing or swallowing problems, as many have dentures, taking multiple medications, and unplanned weight loss. The multiple medications can lead to the change in taste. What to eat. Proteins are a great source for energy and to fuel your body. Choosing a variety of colorful fruits and vegetables, choosing whole grains, calcium-rich foods to help supplement bone, bones, and plenty of fluids, preferably water. The importance of good nutrition in the elderly can help lead to healing of wounds. It can help to decrease the risk for infection, help to strengthen muscle tone, which can lead to a decrease in falls. Poor quality of nutrition is linked to the following health conditions: cardiovascular disease, hypertension, type 2 diabetes, osteoporosis, and some types of cancers. Nutrition is a primary prevention and can help promote health and functionality. Many older Americans could benefit from nutrition services if it were broadly available. The Meals on Wheels program has been shown to be efficient and effective in delivering nutrient-rich meals. It has also been proven to increase the food intake and decrease the nutritional risk in the participants. Meals on Wheels was started in the 50s and has been flourishing ever since. Again, we talk about some home delivery options such as Meals on Wheels, but there are other options like drive-up stores that you can go to, such as Walmart or Fred Meyer grocery stores. Amazon Fresh, you can order online and it can be delivered to your home. That would be for the tech-savvy older adult. And there is a Area Agency on Aging, which is a national volunteer group that helps shop plus other things for the elderly that is needed. According to the National Prevention Council, 78% of men and 65% of women over the age of 70 do not meet the national recommendations for fruit intake. They also don't meet the national vegetable intake recommendations, with a number of 86% of men and 79% of women over the age of 70. Living longer, but is it living healthier? Nearly 61% of Americans aged 65 and older have multiple chronic conditions. However, we know that we are living longer because in 2013 the average age was 79, when in 1900 it was age 49. We can practice healthy aging by staying physically active, making smart, healthy food choices, having regular checkups with our practitioner, and participating in activities that we enjoy. Signs and symptoms of nutritional deficiency are dry, scaly skin, thin depigmentation, diarrhea, and muscle wasting, to name a few. Some benefits of physical activity can help maintain the ability to live independently longer and reduces the risk of falling and bone fractures. Physical activity can reduce the risk of dying from coronary heart disease and developing high blood pressure, colon cancer, and diabetes. It can also help to reduce blood pressure in those already diagnosed with hypertension. Physical activity can help people with chronic disabling conditions improve their stamina and muscle strength. It can also help reduce symptoms of anxiety and depression and help foster improvements in mood and feelings of well-being. Physical activity can also help maintain healthy bones, muscles, and joints, along with helping to control joint swelling and pain that is associated with arthritis. Here is a slide of some characters exercising and staying physically active. Thank you for listening to my presentation, and I hope you learned something.